Good afternoon, everyone. I'm Eileen Doherty, and I'm going to wait another minute or so. We had about 40 people sign up, so I'm going to wait a couple more minutes just to let more people in. Thank you. Okay, let's go ahead and get started. I'm Eileen Doherty, as I said a few moments ago, and I'm the director of the Colorado Gerontological Society. And thank you for this session related to our advanced care planning series on the family conversation. Today, we're basically going to use the Conversation Project Toolkit as the basis for our discussion. It's important to know that the Conversation Project was started in Boulder, and so it's kind of a homegrown project and one that we're very proud of here in Colorado. In 2013, the Conversation Project did a study. I'm hopeful, although I have not seen any more current statistics necessarily with these same questions, about how important it is that you talk to family members and that you share your wishes. So, in the Conversation Project's study, what many people say should happen is that 90% of people believe that we should have conversations about end of life care, but only 27% have actually done so. 60% say it's important to make sure that their family is not burdened with tough or difficult decisions, but only 50 and 56% have not communicated that with their family. So about 43% have. 80% say they would like to talk to their doctor about their wishes, but only 7% have done so. Now, hopefully, that number has increased over the last few years as Medicare is now reimbursing physicians for having end of life conversations as part of your annual wellness exam, should you take advantage of that through your Medicare benefits. 82% of people say that it's really important that we put our wishes in writing, but again, only at that point in time, 23% had done so. So the toolkit that the Conversation Project works with has four different sets of steps that one can take. The first is to get ready. The second is to get set. The third is to go. And then the fourth is to keep going. So we're going to review those kind of as we discuss this afternoon, what is important. And well, we might go about getting ourselves ready to have the conversation. So, as we're thinking about getting ready, we want to ask ourselves a really important question, which is, what do you think about, or do you believe is you need to do before you actually get ready? Um, so, some tips is the first is to start thinking about it. You can do this in a number of different ways. You can write a letter. You could make notes to yourself. You could have kind of a preliminary conversation with either yourself or a friend. You need to realize that as you talk about your wishes, there may be disagreements between you and other people in your life. So, for example, one child may want to use all of the available end of life measures or life-saving measures, while others might feel that comfort care is more important. This is the one of the major reasons that makes it really important to begin to have the conversation now rather than to wait when there is a crisis. Also, it's important to know that the conversation should be ongoing and not necessarily something that is um, only happens once. So, in addition to looking at the things that are important to you at your end of life, it's also important to look at what do you value most. It's the important thing on this, and as we go through this afternoon, there are going to be some opportunities for you to later review, if you will, this PowerPoint and begin to fill in, if you will, some sentences or some ideas. So, as I said earlier, it's a toolkit, meaning that it's that when I send you the PowerPoint, and I'll send you the link to the actual toolkit itself as well, that you have some homework to do. So, one of the first things to do is finish this sentence. What matters to you at the end of life? What is important? So, do you want to be able to recognize your children? Do you want to get the best available care in the best hospital in the country? Do you want to be able to have an opportunity to say goodbye to your loved ones? Do you want to make sure your pets are with you at your end of life? What is the most important thing? You want to share this statement with your loved ones. Um, so the initial conversation really helps loved ones to communicate, helps you to communicate with your loved ones and to your doctors and other healthcare providers about what treatments you want, what will bring you joy, and what will bring you peace. I always say it's important when I am working with people in their advanced care planning that it doesn't really matter what I want, it matters what you want. So, the next thing we're going to look at is these scales, if you will, that can kind of help you figure out your end of life care that you want. So, the first one is as a patient, what would you like to know? So a one is only you want to know the basics about your condition as you go through the steps or the disease or the thought process. Do you want to know all the details about your condition and your treatment? Again, this helps us to know how much information that we are to reveal to you and how much information we are going to just make available. Another big question is as the doctors treat you, what would you like? Do you want the doctor to be in the driver's seat and making most of the decisions? Or do you want to be consulted and have a decision, a say in all of the decisions that are made? And if you're not able to make that decision for yourself, what role do you want your agent or your power of attorney to make as you as they make those decisions? Another important question is if you had a terminal illness, what would you prefer? Would you prefer to know how quickly the disease is progressing? Or do you not want to know that at all? Again, your physician needs to know that, as well as your family members, because these are the things that drive decisions around do I do palliative care? Do I do end of life care? Do I do hospice care? What kind of, what do I want? The next thing is what kind of decision do you want to have in your decision making? So, this is one of those screens where you need to take responsibility and say, what do I want? What role do I want? Am I better in my own sense of mind and peace? and my own consciousness to not really know that I only have 3 or 4 weeks or 6 months to live or a year? Or do I want to have that information and do I want to then live my life accordingly? Another set of questions that is important is how long do you want to receive medical care? So, do you indefinitely want to receive all available care, regardless of how comfortable the treatment is? Or do you want less aggressive treatment? And do you want more quality of life? This is oftentimes true, especially for people who have advanced cancer. Treatment can be very, very difficult, but sometimes the outcome, if you will, is also one where you have more quantity of life, but you may not experience quality of life. What's important to you, and if you were to live a few months less because you took less aggressive treatment, but you knew everyone around you and you were not suffering, would that be more um, in line with with your beliefs? Another concern, and as I was preparing for this presentation, one of the things that I read, and I know I have known people who have had this concern, is that if they make an advanced care plan, that they are worried that they will not get care, that somehow when they make an advanced care plan, they they are concerned, if you will, that that is a license to family members as well as healthcare providers that they want less aggressive treatment. That is not the case. If you want very aggressive treatment, you need to make that known. And again, the concern about will you get enough care or will you get too much care? If you are involved in your decision making or your loved ones are involved in that decision making, they can help to guide those decisions. Another thing that's important is to share about your preference about where you want to live your last days. If you would not mind living your last days in a healthcare facility where other people are taking care of you, that is absolutely fair. Or do you want to spend your last days at home? What I want you to be realistic about in this question as you are reviewing your own preferences is there are some conditions and some situations in which you will not be able to spend your last days at home. For example, if you had a really debilitating stroke and you were not able to help in any of your care, if you do not have the support system, the money to hire 24-hour private duty care, or at least some level of caregiver or nurse's aide kind of support, you may end up spending your last days in a facility. So just because your preference is not to do that does not necessarily mean that your agent will be able to abide by all of those wishes. So as you think about that, then think about your answers to these 3 or 4 questions and be very reflective about how you want or what kind of care you want. If you're erring on the side of all ones and twos, it's important to share that information with your loved ones as we go through this process. If you're ending up with more fours and fives, then you need to share that information as well. The next question that's really important in this decision making is what role do you want your loved ones to play? Do you think that your loved ones know what you want? Do they have any idea? Do they have any hints? Can they call on past experiences? So that's the kind of thing that they will use if you don't share that. If you share that information, they'll be in a much better position to carry out those wishes. So let's take a look at this next group of questions, which really has to do with the community, your family, and the people around you. So, how involved do you want them to be in your life? Do you want them to do exactly what you said, even if they are uncomfortable carrying out your decisions? Or do you want them to do what brings them peace of mind, even if it goes against your will? So again, some children are very able, if you will, to say, this is not what I want. This is what mom or dad wants. Other people are not going to be able to do that. And they're going to substitute their values and their biases and their judgment on you. When you are in the dying process, what is your thoughts about privacy? So, do you want to be totally alone or do you want to be surrounded by loved ones? And again, we don't have any control over this in the sense that you may pass away without your loved ones in the room, or they may be all nearby. So, for example, although my mother never did share this kind of information, particularly with us, because she was one of those individuals who really feared not only her own death, but she feared that people would use information negatively against her. So she actually did die in a hospital, but she did die only with healthcare professionals around her, but all of her family was in the waiting room except for myself. So all her children, all her son and daughter-in-laws, many of her grandchildren were with her. They had seen her a few minutes earlier and were in a position to give their goodbyes, but they were not actually in the room due to the nature of how she passed away. When it comes to sharing information, again, with your family or with other people that are close to you, do you want that information to be very private and not be shared? Or do you want people who are close to you to know everything about you, your health status, what's happening, and how they can be of support? This one is kind of similar to a previous question, which is, what would you like to know? Do you only want to know the basics? Or again, do you want to know all the details about your condition and the treatment and what that means? The other thing that I have found sometimes in my work over the years in this area is that people do sometimes want to know, but they don't necessarily always have the capacity to understand all of the details. And so I have sometimes had to be very measured, if you will, in the amount of information that I could share and making sure that they could understand what level of information I was sharing and how that was affecting their situation. So now that we've been a bit reflective, this is another opportunity for us to really identify the three most important things that we want family, friends, and our healthcare providers to understand about our wishes and preferences. We want to have those followed as much as possible, and we want to make them people aware of them. We want to maybe even write them down or have multiple conversations. So now we're ready to go to step 3, which is to start thinking about the conversation itself and what we should talk about. So, who do you want to talk to? And this is going to vary for every single one of us. Not many of us, probably at this point in our life, have our own parents. Some may not have a spouse or a partner. Some of us may never have married or have children. So we'll have various different levels of individuals who will be involved in our conversations. Another thing to think about is when would be a good time to talk. So, is it at the holidays? Is it before an important event, such as a child going off to college, before you take a trip? I would say that the next one is probably, and for many of us, the most important one is before you either get sick or get sick again. Sometimes the most important time to have the conversation is when you are visiting with family or at the next family gathering to really allow time for that to happen. Sometimes conversations are also easier in certain places. So sometimes the kitchen table in our family, it's the living room. And our family knows that if there are important conversations to be had, we do that in the living room. But oftentimes we do many other things in the living room as well. It's where we share family time, where we share important information and discussions. Some people do not want to be in their own home. So they may want to go to the restaurant, they may want to go to a park, they may want to go on a walk. So there's any number of places that might make sense for you to have the conversation. But again, it's important that you think that through so that you are able to set the stage properly and not have people dipping in and out of the conversation, joining, only hearing part of it, and not really engaging. Um, and this then is a slide, again, a repeat that says, what do you want to make sure you talk about? And this should probably be the three most important things that you ended in step 2 with, because then there's consistency and continuity in what you're saying and the messaging that you're giving. So the next thing that's kind of important is how do we really sort of talk about this? Um, what do we say? Um, so sometimes we can put ourselves in a relatively vulnerable position and we can just say, I need your help. Um, Sometimes, especially if it's been traumatic for people, we can um, relate the end of life uh, uh, experience with a other family member or a family friend. And we can talk about either what we liked about that or what we wanted to be different. Many, many years ago, a cousin of my mother's passed away, and she wasn't able to join us at the funeral service. And I went for her. And one of the most beautiful things that I observed was the young children. There were 2 or 3 of them, like 3 and 4 years old, and they were allowed to just go up and stand in front of the casket. And they were talking to Grandpa, and they touched him, and they were just like sharing a conversation as if he had been sitting in his rocking chair. It was one of the most beautiful things that I found for young kids in my own sort of sense of how do you help young kids say goodbye to grandpa? And they weren't always saying goodbye because they hung out there for more than an hour. Another way to start the conversation is to just, say, I was thinking about what happened to so and so, and it made me realize how I want things to happen. That again puts you in a position where you are just sharing what's important to you and what you believe would be beneficial. Sometimes people don't want to have the conversation because they think that everything is okay. So part of what you need to do is to say, yes, I am okay. but I'm worried or I'm concerned that if this happens or if this situation escalates in my life, I want to be prepared, and here's what I would like. Some of us are always in the planning mode, and so thinking about the future, asking people to make sure that we all know as much as possible how we can plan and manage the future, and asking for specific help in doing that. And another way is to just say to somebody, I've been working on my end of life wishes, and I've started to think about that. And I really would like to share what I want with you. And I'd like to see how you're feeling or what your thoughts are about it. So, in addition to that, you also want to think about um, conversations that how you might want to share with your loved ones what you want. So, other things you can do is to say, I want to talk about the last phase of my life and what's important to me. Again, it gets back to those value statements. What is the one thing that you want to have happen and to make that the priority? You might use this as an opportunity to share concerns about your health. And as that condition progresses and you enter the last stages of that condition, this is what I would like to have. Another way to approach the conversation is to say, I have done these things, but I still haven't done these things. So, for example, my husband and I, we have bought a pre-need funeral. We have the cremation and all of that done. We have the plot purchased, but at the stage of the game, we don't have a stone. And so, that's a way to have a conversation with the kids about this still needs to be done. And if I don't get it done, you're going to have to do it, kind of thing. Another thing, again, depending on what level of privacy and relationship that you want with family and friends, this is the opportunity to really share now as you're having the conversation about who do you want to be involved in the decision making, or and what your role is in all of that, as well as your medical power of attorney or your other family members. Here is the next thing is the opportunity to share the amount of your involvement in the decision making. So if you answered the question earlier about, I only want to know a little bit about my condition, then this is the time that you can share that. If you answered that I want to be extremely involved in the care as well as the treatment, then this is when you share that information. You need to understand that not everybody in your family is going to share what you want. So there may be some disagreements, and this is your opportunity to also share that, especially if you have more than one child or grandchild or multiple friends that are going to be involved in your decision making, so that not only you understand where these disagreements are, but that you can share them with the other loved ones or people who will be around you, so that they also know that disagreements will be there. And here's what you've done to share that with everyone. Sometimes people really want to be involved in certain milestones in their life. So somebody may be wanting to get to their 100th birthday. I keep thinking about Jimmy Carter and the fact that he is 99 years old and has been on hospice for an extended period of time. And I keep thinking, is his goal to be the first president of the United States to reach 100? Other people have other milestones, like seeing a grandchild get married or graduate from high school, whatever. The importance of discussing these milestones is that your loved ones or you can make those important events in your life. So, if my goal, going back to Jimmy Carter again, is to live to be my 100th birthday, then his family knows that maybe things aren't going quite so well a month or two before he gets to 100. So, maybe they make sure that they celebrate that early. Or if you reach that day, whatever that day or milestone is, that there's some celebration around that and some recognition, so that you have reached that milestone. This is where you basically tell people where you want to receive care. A lot of times in our work these days, people say, I want to live in my own home, but sometimes people are also starting to think about maybe I'll go live with my daughter and I want to live in my daughter's home. And that's okay as well. Making sure that the daughter is okay with you moving in with her, that she has the ability to care for you, and that her family is okay with that decision. This is also your opportunity to say, I want or I don't want various kinds of care. So, do you want ventilators? Do you want CPRs? Do you want feeding tubes? And again, it's very important to understand that what I want today at my current age, 10 years from now, 15 years from now, I can change my mind. You can change your mind. As you're having this conversation, always reserve the right to say, if my condition changes or as I get less energy or less able to make decisions, I would like to change these and I would like to revisit this conversation. Again, you may not know what you want to change to. That's okay. It's just leaving it open. Again, if you are going to be changing these kinds of things, make sure that all of the important people who are part of this decision-making team, or at least the people who need to know or might be weighing in, know that you have changed your mind. Another thing that you should include in your conversation is if I'm in this situation, I want you to do whatever care I need to make me healthy or to maintain my health. If certain things happen, then I want you to switch to comfort care. If you always want curative care, there's nothing wrong with that. My father was that way, and I knew in my heart that he wanted every single bit of technology used to preserve his life as long as possible. His attitude was one of a very devout Catholic, and his attitude was if God didn't want us to use all these things to stay on this earth, he would not have given them to us. Again, I personally may not have agreed with that even when he passed away 30 some years ago, but I knew that that's what he wanted. So that's what I told the care team they had to do. And then you have the opportunity here as you're having the discussion, if there are other things that are important to you, such as organ donation, what to do with your pets, those kinds of things can also be included in this conversation. So when you are starting this conversation, you need to remember that that you have to be patient. Some people may not want to think about the fact that their mother is ever going to be sick or that their father will not be the individual who is always in charge making decisions. These are very, very difficult for some people. And so you may have to have multiple conversations. You may need to have the conversation in bits and pieces. You may have to provide opportunities for people to talk to you. So just know that this is probably not a one-time only conversation and that it will take some time. You don't necessarily have to have a specific agenda. It might actually feel better to you and your family if the conversation just happens. Um, it's okay to have a list. It's okay to have notes, but trying to be what we call sometimes just yourself or authentic can be better than I have a list and I need to get through it. Again, don't judge people. What might be a good death to you might mean something very different to somebody else. One of the things we'll be covering in this series later in the year is the medical aid in dying program. And for some people, that could be a good death, while others might define a good death as hospice care, and others might define a good death as my father and using every available technology. Remember that nothing is set in stone. You can always change your mind. Your loved ones can change their minds. Circumstances are going to change. None of us can predict the future. Whatever conversations you have, understand that they're always, always valuable, because again, the value is in having more than one conversation. The value is getting more and more clarity, if you will, about the services that are being, or about the situation and what's being discussed. The last step then is to keep going. And here you're basically going to use these questions to kind of collect your thoughts about how things went, where you want further conversations to go. So as you reflect on this, is there something that you need to clarify or that you feel was misunderstood or misinterpreted? This can easily happen, especially if emotions are high or if people are somewhat anxious about the conversation that is going on. The next item to look at is, who do you want to talk to? Are there some people who should hear this? Are there siblings? So maybe, for example, you've had conversations with your own children and your grandchildren, but sometimes your siblings might be asked to weigh in on these conversations. And if that is the case, what is their thoughts? So you may want or need to have that conversation. Think about your own feelings as you had this conversation. Did you feel comfortable? Are there things that you felt particularly anxious about? Are there subjects that you avoided? What are things that you want your loved ones to remember, and how do you reinforce that? What should you talk about the next time? Because hopefully there will be a next time to better understand between you and other people that you are working with what it is that you want. So that concludes my remarks about having the conversation with your family. This is just a little bit about a couple of the programs that the Gerontological Society has. We currently have grants to provide vision, hearing, and dental services to help low-income individuals with glasses, hearing aids, and dental care. We have a telephone buddy program and a mental health counseling program. The telephone buddy program is one in which volunteers are placed with older adults to call them on a regular basis just to check in. Our mental health counseling program is very focused on people who are experiencing certain situations that they may want support with, such as grief or loss of a family member, loss of a pet, having to move to a situation where they're not comfortable, finding out about a new chronic disease and figuring out how to manage that. We also have grants at this point in time for low vision aids, so we could help with like amplification programs, or I mean equipment, magnifiers, stuff like that. We also do counseling and public benefits support. We have a housing and home care locator where you can find housing and home care by licensed facilities in the state. And then if you're in the Metro Denver area, we also provide holiday basket support. We also do our Salute to Seniors, which is a big senior expo, will be August 24th in Denver at the Greek Events Center from 9:30 to 3, and we'll be virtually on Sunday, August the 25th. More details and information to follow. Watch our website. We'll be doing our Medicare Monday programs in the fall as well. There'll be a combination of some sessions will be in person and some sessions will be virtual. We do a lot of housing and economic security advocacy, public policy kind of advocacy, as well as we have our senior resource guidebook, of which about 10,000 copies have been distributed to libraries around the state. So those are a little bit about our programs. There's a lot more information at our website. And thank you all for joining us today. So I see does anyone else have any comments or questions that they would like to ask at this point in time? Okay, we'll be doing a couple of more sessions as the year goes on. And so we encourage you to join us and look forward to sharing information about advanced care planning. Thank you again.
Thank you.
You bet.